The field of gene editing therapy has reached a pivotal moment, ushering in a new era for treating chronic diseases. The first generation of this technology, CRISPR-Cas9, often dubbed genetic scissors, precisely targets specific segments of DNA, guided by RNA molecules. By introducing targeted cuts, it can disable malfunctioning genes or facilitate their repair. Exa-cel, the first FDA-approved CRISPR-based therapy, holds immense promise for treating sickle cell disease. The second generation, known as base editing, takes a more nuanced approach. Instead of cleaving DNA, it meticulously swaps individual base pairs with the genetic code, akin to a molecular pencil and a razor. This technology has yielded VERT-101, a promising treatment for lowering LDL cholesterol, currently undergoing clinical trials. Early results indicate significant potential for this groundbreaking therapy. Gene editing therapy represents a revolutionary paradigm shift in treating chronic diseases. It offers the possibility of transitioning patients from daily pill regimes to infrequent, potentially curative injections. The aforementioned therapies are merely the first step on this transformative journey, paving the way for improved treatment, adherence, and enhanced outcomes. We should wholeheartedly commend the scientific community for this monumental achievement and eagerly anticipate its continued advancement at an accelerated pace. Thanks for likes and sharing.